most famous physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to show you how to treat neck headaches with self-massage and more. So neck headaches, we're talking about those headaches that you feel right in the suboccipital region, right at the base of your skull where it meets the neck. And quite often what is happening is it's tightened up from poor posture.
Yeah.
It's
Head
got
forward.
Head forward posture, and you might even be putting pressure on what is called the greater occipital nerve, which exits out through that area.
Yep.
Now that nerve, if you get involvement, you can actually get pain that comes all the way around into your eye.
Mm-hmm.
They actually call it ram's horn because it kind of looks like a ram's horn.
Sure.
And it could happen on both sides, but it's generally one-sided, but it could happen on both sides.
Yeah, so that nerve exits here, and it just, if you look on an anatomy thing, it comes right up around like that ram's horn. I've heard some people call it a wrap or a full wrap when they feel the pain all the way to the forehead.
Gotcha. So let's go right into it, Brad. Let's go right into the massage. We don't like using any accessory tools on this.
Yeah, it's all manual. You don't want a massage gun. Or
one rule of thumb is that you never massage over a pulse.
Mm-hmm.
And, you know, the vertebral arteries in there, and it's kind of a sensitive area there. You just don't want to use a massage gun. You won't want to use a massage cane.
Yeah.
It's easier, safer with the hands.
Yep. I've tried it with these things.
Yeah, I tried it.
It's not good.
I did it to myself. I'm like, wow.
All right, I'm going out. I'm
My
going
teeth
silent.
are rattling. Yeah, Brad's off mic now. You want to go ahead and first do circles, Brad. So he's going to work his way along the suboccipital region there. Get yourself a good posture. Is what he's saying. I'll be his interpreter. So yeah, don't want to be in bad posture while you're doing this. You really want to be in good posture. So he's doing circles all the way along the entire span there, and then he can do some spleen massage too. Got a lot of spleen to do, Brad. There you go. Yeah, so he's groaning right now. So he puts his fingers together and he pulls them right apart, and he's digging in pretty hard. Now you can do this, you know, a couple times a day, and if you're starting to feel some headache coming on, try to jump on it before it gets too severe, because once it's going, it's hard to get it to stop again until the next day. Oh yeah, make sure you're always breathing. Take a nice deep breath. Don't hold your breath while you're doing this. All right, next thing Brad's going to show, since doesn't have his mic on, sometimes there's a lack of rotation that is causing the pain. So like, let's say I rotate to the right and it's normal, but I rotate to the left and it's really tight. You may want to restore that motion, because sometimes by restoring the motion, it takes away headaches and neck pain. So Brad, which way do you want to go?
Well, Bob, I'll go either way.
Okay.
Right.
All right. He's going to go to the right. So you want to have the selvedge. It's the knitted end of a towel, and he uses that. Gets right along the edge there on the selvedge, and you're right below the ears, coming up to the eyes. Yep. One show from the side, Brad. So. Yeah, it's under the ear, but it's coming up to the eye, and that's about the right angle to be at. So what do? You switch hands. You see what he just did? He switched hands, and he's going to pull across with that one, and that's going to, you know, if he's decreased rotation to the right, hopefully this should be pain-free, and it should feel a little better, and you might get a little more rotation by doing this. This one, yeah, across the jawline. This one should be pulling straight down, not going across you to choke yourself off. Yeah. So pulling straight down. Sometimes it helps to even have someone hold your shoulder, and sometimes you can even ask someone to give you a little pressure. You know.
A bigger towel helps too.
Yeah, and a bigger towel helps. So.
Show from behind once.
He's going to show it from behind now. Same thing, good posture with this, and breathing. And you can obviously, you know, absolutely go the other way too. Are you switching? Oh, you just. Oh, you just. He switched fast. Yeah. So same thing. This seems a little bit difficult to do, but it can be very effective, especially if you're having neck pain there or headaches.
Yeah.
All right, next thing. Oh yeah, he can do the same thing with the stretch out strap here. This actually works really well. This actually works better than a towel because you can really dig in there. You really can get into the spot. Yeah, it's easier to hold on to, as Brad is saying, because you don't have to. You got loops. So there you go. Brad from all angles. Again, good posture, breathing under the ear, up to the eyes, kind of heading up there across the jawline. I'd say, again, as long as it's pain free, you can keep doing it. You do maybe reps of 6 to 8, and you can do it. The first day, just do it once to see how you tolerate it. But the next day, you could do it, 4 to 6 times if you'd like. If you have arthritic hands, you can just put your hands in the loops, and you don't have to put stress on them. One thing with arthritis, we're always stressing that you put stress on the larger joints instead of the small joints, like your fingers. All right, the next one, we always, a video wouldn't be complete, Brad, if we didn't mention the chin tuck. So you got to make sure, if you do chin tucks like this, you actually are stretching out that upper neck. So, and it's putting your neck in the right posture. So it's a reminder throughout the day that, oh, my neck's not in the right posture. I'm going to put it in there. I'm going to also treat a little bit. Now, with these neck headaches, what's really helpful actually is to do an overpressure for a lengthy time. So like if I go like this, do a little overpressure, I'd try it for 35 to 45 seconds sustained. And if there's no increased pain, I'd go up to 2 minutes and hold it. That's a long time. That's a long time. Brad was reading a book on myofascial release. Brad, why don't you get hooked up? All right, so we did the rotation, and the last one you can do is you can do a little bit of flexion. You can actually take your fingertips and pull down and gently pull down and feel a little bit of stretching in the upper neck. Or you can actually put a fist under your chin, or I like to put it this way, thumb down, and just, again, gently grab, because you can actually put a fair amount of stress on there, and, go like 10 seconds where you hold on and do it like 3 times.
I'm back.
He's back.
Hi, everyone.
Yeah. So, the massage is something you can do throughout the day. It's very innocuous. It's not very,
Innocuous?
Yeah, innocuous.
Oh, I have to look that one up later.
There we go. And you'll find out it's helpful, especially, like I said, if you can get at it before the massage, before the pain is starting to increase too much.
Yeah. Yeah,
So,
it's amazing that I didn't even have a headache, but it just feels so
good,
good
right.
to do that.
Yeah.
And you can do that in 30 seconds.
Yeah.
Take a break while you're working. Go ahead and massage. And, maybe you could, get a family member to do it for you at home. And it's always more fun when someone else massages it, isn't it?
that's right, I would say. It's a family show, Brad.
Well, Bob.
All right, thanks for watching.